This morning, our subject for this half of the show is breast cancer, and October being Cancer Month, I'd like to welcome our guests. They are Dr. Bharwani and Pat Dietrich. Welcome to the show.
Thank you. Thanks, Ken.
Good to have you here. And Dr. Bharwani, maybe I could start with you first of all. And you've been working in, I guess, the cancer field for a long time, past president of the Canadian Cancer Society. And today we want to focus on probably one of the, I guess, fastest growing cancers, so to speak. I don't even know how to phrase it without sounding too untasteful, but the breast cancer is getting more popular all the time.
That's true, Ken. About 12% of all women will develop breast cancer in their lifetime, and 3.5% of all women will die each year from breast cancer. And about each year, there's a rising incidence by about 1.2%. So there is a gradual increase in the breast cancer incidence worldwide and Canada as well.
Mm-hmm. Can you put your finger on it? Like, who gets breast cancer?
There's we don't know exactly what changes the breast cell into cancer, but there's a group of women who are at a high risk of getting breast cancer. Any woman over the age of 50 is at a high risk of getting breast cancer. If she has had breast cancer on one side, then there's an increased chance of getting breast cancer on the other side, or on the same side if she has had a segmental mastectomy. If the woman has had menarche or started her periods before age 12 and went into menopause after the age of 50, puts her at a higher risk of getting breast cancer. If she's never had any child, or if she had her first child over the age of 30, then puts her at a higher risk of getting breast cancer. And the most important, as far as we know, is that if there is any family history of breast cancer, first degree relative, then puts her at a very high risk of getting breast cancer. So these are the women who are usually targeted for detection on an early basis.
Mm-hmm. So hereditary is a large factor.
There's a large group with the genetic breast cancer.
Okay. Early detection is what we're basically the theme of today's whole program. Very important.
Yes, early detection can be done in several ways, and they are all set procedures. Number one, women should do breast self-examination, and Pat will talk about that later on. And the breast self-examination usually is advised after the age of 40, but I tell my patients that tell your family, any member of the family, women, females in the family, they should start to learn doing breast self-examination once they start their periods, basically. And it's just like getting into the habit of flossing your teeth and brushing your teeth, like you have to do breast self-examination. And only then you recognize what is the normal anatomy of your breast, and if there's some change, you can differentiate right away. Then the next group is, next test we do is a mammography on a regular basis. And again, there's some controversy as which age group should be targeted for mammography, but it has been shown statistically that women between 50 and 70, if they have mammograms done every 2 years, you can save about 40% of the women from breast cancer or dying from breast cancer. Between the age of 40 and 49, if somebody falls into one of those groups of high-risk group, then it will be a good idea to have a mammogram done at the age of 40 and then every other year. Even after the age of 50, we advise breast mammograms done every 2 years, unless somebody is at a very high-risk group, then every year is advisable. And annual physical examination with the doctors or the trained nurse once a year. And all these three things together can produce good results.
Mm-hmm. Pat, you teach a class in self-breast examination, and how did you get involved in that?
I was approached by a lady about 5 years ago who has been doing these classes, and she asked if I was interested. I was, and since then I've been doing the majority of them for the Cancer Society.
Okay, now could you, I guess, describe what a class all involves?
Sure can. The class itself involves a video produced by the Cancer Society. It talks about breast cancer. It shows women doing breast self-examination. It tells why they should, how they should, and what to do if they find a lump. The video is about 15 to 20 minutes long. Then there's a question and answer period. We have models of breasts with lumps in them so that women can feel what a lump might feel like, pamphlets, and that's about it.
Now, popularity of the classes, is that going well, and how often do you do these?
Every fall, the Cancer Society sends out a letter to all groups in Medicine Hat and District, and then they respond to the office and then arrange with a volunteer to go out and give the class. There usually is a flurry of activity for me in the fall, and then again in late spring. It's done on an individual basis for the group. It's arranged at their convenience and at mine. The groups range in size from 2 women to I think the most I've had in a class is 68. So it can be a small group, it can be a large group.
68 sounds like a convention.
It was a big group.
Age groups now, do you see a certain age group? I mean, mostly over 40, or would you say you get a good mix?
A pretty good mix. Not as many young women as I would like, because as Dr. Barwani has said, a lot of it is developing that habit of doing breast self-examination every month. And habits are very difficult to form. It takes a long time to develop that habit, and I would like to see the younger women at the groups. The bulk of the age is probably 40 to 60 years. However, the oldest lady that I've seen in a class is 98. So it covers the whole gamut.
You also do them out of town.
Yes, that's right. Our district goes from Bassano South to the border, to the Saskatchewan border, and over past Bow Island. So we've done a number of rural community groups as well.
Doctor, do you ever get involved with the classes in that aspect, or does the hospital do something on an ongoing basis, you know, right inside?
I don't think there's anything in the hospital as far as breast self-examination is concerned. We do have videos borrowed from the Cancer Society, kept on the floors for any women inpatients who would like to look at those things. But I'm directly not involved with the breast self-examination unless I see a patient in my office and advise them and give them pamphlets and show them how to do it. But I don't do classes as such for breast self-examination.
Okay. Before we get into some Starling, you brought some really interesting graphs along here. I want to ask Pat, what does a person do if they'd like to take one of your classes?
The best way is to phone the Cancer Society office. And Ken, I believe you have the number there. 529-8015.
You bet, I had it here too, just in case you guys didn't remember it. But
So if anyone is interested, they could phone directly to the Cancer Society office, and arrangements will be made for a volunteer to come to them or their group, and we'll discuss breast self-examination and show them how.
Okay, thanks very much. Dr. Barwani, the chart I'm going to show now, could you describe what that's involved in that?
Well, we started doing mammograms in Medicine Hat in 1990, and this brown bar is the mammograms done at the Medical Arts Clinic, and these are the ones done at the hospital, because the hospital started doing them later. And I just wanted to show you here what a tremendous increase in the number of mammograms we've been doing. 2,997, there's about 3,000 done in 1990, and 1991 increased by 874. And we are doing more mammograms now. That means we are detecting more cancers on an earlier basis. And this will show you here. And this is the figure from 87, 88, 88, 89. Number of mastectomies done for cancer. These are the figures here. And these are the breast biopsies done, open breast biopsies in the operating room. And after we started doing mammograms, the number of mastectomies has increased. And you can see the jump in the number of biopsies we do. Because something is picked up on the mammogram. So mammogram is a very good stuff, very good test for detecting early breast cancer. But one should remember that mammograms can miss anywhere about 15% of breast cancers. You know somebody's got a breast cancer and do a mammogram, it may not pick one up. So the sensitivity is good, but not that high. And so if there is a lump in the breast, it has to be examined thoroughly with a needle biopsy and even an excisional biopsy in the operating room, to make sure that there is no cancer.
Don't have too much time left. I guess the cure, or not the cure, but the treatment is just, like you said, once a year for an examination, do the ongoing breast examination.
breast self-examination every month after 7 to 10 days after the periods, annual physical examination with a nurse or with a family doctor, and the mammograms as indicated on the advice of the doctor.
Great. Thank you both very much. Don't go away. We'll be back right after these words.